You're listening to a Raconteur Studios podcast.
Hi, I'm Dr. Emma Craythorne. Welcome back to the After Hours Skin Clinic, where the door is always open. The chat's always honest and the facts are always on it. And I'm here today with my dear friend and colleague from Clinic, Dr. Ellie Rashid.
Hello, darling, and listeners.
And in this episode, we're going to be talking about a subject that's really close to both of our hearts. And we talk about this a lot. And the infuriation that goes alongside it, trying to explain that menopause is not a skin type.
Yeah, so true.
I mean, it's infuriating, isn't it, where menopause is put onto tablets, vitamin supplements, creams, topical solutions, and that's actually being just used as a marketing term.
It's massively being used. I mean, it's amazing the work that's gone on to recognise menopause, perimenopause. I think it's wonderful. But I think to stick the word menopause, perimenopause on products, to then sell those products, it just doesn't quite work. We don't all fit the same skin type once we're at a certain age.
I mean, that's exactly right. I find this really fascinating because I've worked alongside L'Oreal now for many, many, many years as part of their kind of advisory boards. And Vichy, one of the companies, had a product out probably around about 15 years ago. I think that product was out now. And it did terribly because nobody wanted to admit that they were going to go in and buy something that suggested that they might be in the menopause or the perimenopausal period. And the product just didn't work at all. So one good thing about having such awareness around the menopause is actually now the exact opposite is true. And menopause is being put on all of these products to essentially sell them. So the awareness is great, but it's almost been overplayed now, don't you think?
Yeah, it's been overplayed. And also then as the consumer, you're going to buy a product thinking it will solve all the problems that happen within the skin when you go through the perimenopause and menopause. It doesn't work like that. If we start with what happens to our skin as we enter the perimenopause and menopause, so as we know, our estrogen levels start to decline, and that usually results in a degradation of collagen, and our skin becomes more dry and can thin, and our elastin starts to degrade as well. So our skin doesn't have that same bounce that it used to have. It's not as plump as it used to be. The top layer of our skin doesn't reflect light in the same way because our skin cell turnover slows down. All of those things contribute towards our skin looking different to how it may have looked when we're in our teenage years and 20s and maybe 30s. And so to say that there's a product off the shelf that addresses all of those problems in every single person, I don't think is fair, and I don't think it is true.
I think that's exactly right. So we'll go to the point of, well, what is the menopause? Well, the menopause is a single day in a woman's life. That's it. A single day.
Yeah.
That's all it is, just one single day. But what actually happens is in probably around about the 10 years before that single day, there are fluctuations and changes in the hormones of estrogen and progesterone that ultimately are going up and down, but generally on a downward trend until the point where the woman no longer has a monthly period. And then after that point is officially in the menopause. And then you go to the postmenopausal time.
Yeah. So menopause is 12 months after your last menstrual period.
So you might have about 10 years before that one day of menopause, and then you'll have the rest of your life after, and you're essentially postmenopausal. So I always find it quite funny that you're going to all this hassle of writing menopause on something when that's just one day in a woman's life. Surely it should be perimenopausal or premenopausal or postmenopausal.
Yes. And all of the changes that happen within our hormones, they fluctuate quite significantly leading up to that menopausal day. And so often my patients will say, oh, can't you just check my hormone levels to see what the influence is of those hormones on my skin? But you might catch your hormones at a particular peak or a particular trough. And so it's difficult to measure it because they fluctuate so much. And then secondly, we don't know what influence those fluctuating hormones are having on your skin cells. So even if, for example, you've got a condition like polycystic ovarian syndrome, where there might be a higher number of these male circulating hormones called androgens, your skin cells are more sensitive to those raised circulating levels compared to someone that doesn't have polycystic ovarian syndrome.
There's so many things that happen during that perimenopausal and postmenopausal time. But if we think about what happens to the skin when these hormonal fluctuations are starting to happen, and at the moment we'll try and discount all of the other things that are going on in terms of bone loss, brain fog, palpitations, all of these other things that happen during that time, just concentrating on the skin. Our skin has so many estrogen receptors in it, and whenever they're not being fired up in quite the same way, one of the symptoms I see in this premenopausal time is itching. Do you see a lot of itching in your patients?
Yeah, I do. So often they'll say that their skin's itchy, but also they do comment that it's quite dry, like just different to how it used to be. Feels dry and itchy.
Yeah, so you've got this combination of your skin barrier perhaps not working in quite the same way and this sensation of itch that can occur. And some people actually get what they think is eczema for the first time in their lives in and around this time. So one of my key things is always telling people to use a moisturiser. And it might be the very first time that woman has had to use a moisturiser on her body. Because, lots of people don't need to use a moisturiser in their body every single day. But getting out of your hot shower, actually, for some people, can then end up making their skin feel really quite dry and uncomfortable. So one of my top tips, I'd say, is to make sure that you have a moisturiser that you like to use if you're somebody who started to get itchiness and a kind of dry sensation to the skin. And moisturisers I really like are the CeraVe, so these ceramide-containing moisturisers with a high glycerin content, so, even the cheaper ones like QV, and then things like, of course, the Lipikar Balm.
Yeah, we love the La Roche Lipikar.
But it's more than just trying to keep the skin moist at that moment in time, because keeping the skin barrier protected, you're actually going some way as well to reduce the inflammation just generally in the skin and perhaps stopping things from progressing to a dermatitis, or some people then start to become irritated by other chemicals they might come into contact with, which they never have done before. So that's one of the things I see a lot of in perimenopausal, premenopausal skin is this reduction in the skin barrier and this dry, itching sensation.
Women often say that they've lost that luminosity and that light reflectance that they used to have off the surface of their skin. And that happens because as we get older, so all our cells are dividing into two identical daughter cells. But as we age, that process of cell division slows down. And so then you get this accumulation of the dead skin cells at the very top of our skin that doesn't slough off in the same way. And it's that accumulation of these dead skin cells that means that light doesn't reflect off the skin in the same way that it used to. And so products that I normally recommend to try and improve that and to exfoliate the top layer of the skin are things like alpha hydroxy acids or beta hydroxy acids to help with the oil production as well. And then my top recommendation is a vitamin A like tretinoin.
And it's so true because as dermatologists, you can look at someone's skin and see whether they smoke or not. And you can look at someone's skin, see whether they put their SPF on or not. And look at someone's skin and see whether they're using a prescription grade retinoid because they have the glow.
It does really give you a glow.
It really gives you the glow. And it is exactly what you say. So if you imagine shining a light off a bumpy road, it doesn't reflect back light in the same way. So I was trying to explain this to somebody. I was saying, imagine you've got a dirt track, it's raining, you've got a light shining on the dirt track on the rain. It just scatters the light. It doesn't reflect back in the same way. But if you've got like a really sharp, smooth, tarmacked road and it's raining and the light hits off it, you can see it's like a beautiful stream. And it's a little bit like that, isn't it, with our stratum corneum?
Yeah.
Because you've just smoothened it all out and the light just reflects back almost at the 90 degrees that it's hitting it in the first place. So that's how you get the glow.
The light's bouncing off your skin, Emma Craythorne. Very beautifully so.
The light's bouncing off your skin, Dr. Ellie Rashid. It also is quite bright in here, but there's a lot of light.
Yeah, there are quite a lot of studio lights, but you are looking particularly glowy.
What are the other things that happen with our skin? We got distracted there by the glow.
I mean, the other thing that happens is the hormonal patterns of acne that women get.
Yes.
So women feel so hard done by because most people associate acne as being a teenage skin problem. But there is this sort of second peak of acne, which is usually in women around the perimenopause, which is really difficult because often you're also at a stage in your life where you might be thinking about having children, and some of the treatments that we would use you can't get pregnant on in terms of tablet treatment that we might use to help with acne.
And the other thing I find
Struggle.
really frustrating is that the guidelines that particularly GPs have, if you were to be a woman with acne and you go to see the GP, those guidelines are really based around the acne that's occurring at puberty.
Yeah.
So often the topical treatments that might be used, so things like benzoyl peroxide, which is a brilliant treatment for acne in a teenager, but it is not a great treatment for acne in a lot of adult women.
Yeah.
But that's considered first-line treatment. Multiple courses of antibiotics. These are the guidelines that GPs essentially follow. And it must be frustrating because that is not going to be the helpful solution for a woman who has adult female acne.
Yeah. And many of the topical treatments that are recommended are quite irritant and drying. And as we've said, as we get older, our skin is more dry because of the declining rates of our hormones. And so I think to then put an irritant ingredient on as a leave-on product. I mean, I like benzoyl peroxide as a wash.
Yeah.
Yeah. But I find it too irritant as a leave-on product for that group of people.
What I do for adult females with acne, and this is generic, of course, is that I ask them to cleanse actually with a gentle skin cleanser that doesn't have any alpha hydroxy acids in it. It's just a very gentle cream cleanser, synthetic detergent. That's in the morning. And then I typically ask them to put on a vitamin C as their serum. Then I'll have them put on a fairly light but still moisturising moisturiser, even though you have acne. I like ones like the Roche-Posay Effaclar H. It's one of my favourite go-tos. And then the SPF, not ever forgetting the SPF and remembering that a lot of people stop using the SPF because they think it's going to clog up their pores. And, that is just not the case. And typically a lot of the problems actually with adult female acne is not necessarily about the blackheads or whiteheads. It's not to do with that. It's not to do so much with the comedonal lesions. And then at night time, I'll have them use their 20% azelaic acid and a prescription grade retinoid. That is my approach to adult females with acne. And then the next step is that having a look to see what the hormones are doing in terms of, is this somebody I could add in an oral contraceptive pill to? Is this somebody that I can add spironolactone into, which is a kind of an anti-androgen agent that is a long-standing drug originally used for hypertension and is used to treat polycystic ovarian syndrome, but also acne. And that is really the drug of choice for these women.
Yeah. I had a patient in clinic recently who had acne sort of throughout her teenage years and 20s, and I was seeing her now in her 40s. Acne has settled and now she's got another peak of it. But she was saying how she was terrified of using a moisturiser or SPF during her teens and 20s. And now she's got all the sun damage from having never really put an SPF on ever. And she's got adult pattern acne. And her skin just needs a whole switch up of the routine. Sounds like you can't be scared of using an SPF or a moisturiser. And actually now we're understanding that acne is driven by a lack of diversity of the microbial ecosystem that lives on our skin. And so actually putting a moisturiser on improves the skin barrier, but also enhances the diversity of the bugs that live on our skin.
And things like our SPF, for example, we know that actually just protecting your skin really from ultraviolet radiation is also going some way to, help with the acne. But you remember, people used to be put under sunlights to treat their acne.
Yeah.
With the UVA to treat their acne.
And lots of people, they do say, oh, well, I go on holiday and my skin always looks much better in terms of their acne. I just think on holiday, you haven't got the stresses of life in the same way. And you're just like a bit more relaxed. And we know that the sun has anti-inflammatory benefits. That's why it was used as a treatment, as you say. But it is really important to protect your skin from UV radiation because it doesn't do you any favours in terms of your skin ageing.
Yeah, that's right. It's useful for that acute inflammatory part. You will see some benefit, but actually it's a driver of acne for the long term. So you're putting on a little bit of cream to make something better. And actually that's fine for that moment, but then it'll just make it worse. It's like putting steroid on rosacea.
Yes.
Don't do it.
Don't do it.
But it'll be fine for one day, just not for the next
Not long
day.
term.
So in terms of increased sensitivity and hyperpigmentation, should we talk about that?
Yeah, so as our skin gets older and some of the signs of sun damage then really start to appear as we get into our sort of 40s and 50s, if not sooner. And so then we've got all the hormonal influences on our skin health. And then we also have some of the cumulative damage from sun exposure, and some of that pigmentation and sun damage then really starts to show. The ingredients that I think are most helpful for that sort of sun damage pigmentation are azelaic acid and tretinoin. And the formulation I normally recommend is Clearer because it works so well. But also you can do things like intense pulse light treatment to help improve some of that dyspigmentation that you get as a result of sun damage. And lots of women within their 30s, 40s, 50s often will come for IPL, intense pulse light treatment.
What do you think? Because we see in this kind of perimenopausal time, that is when there's a very accelerated loss of collagen within the skin during that time, that being on HRT might make some level of a difference, but you can see a decline essentially in collagen, and it coincides with the time where our exposure to ultraviolet radiation in our teens and 20s is really just caught up with us. So you've got this almost perfect storm of declining collagen and UVB damage, UVA damage, all happening, poof,
all at once,
all kind of in the mid-40s. And so there is then this push to think, okay, I need to do my best, better aging. We'll not use the term anti-aging because I abhor that term, but we'll use the term better aging. I've really got to get this nailed down at this point. And it's also at a time where probably you've got enough money to spend on things. And that's where this kind of whole marketing term probably comes into play of sticking the word menopause on things. Should we talk about where people should spend their money?
Yeah.
What about an LED mask?
No. So I normally say to invest your money in your vitamin A, so retinoid, that you use at night, and also in your antioxidant that you use in the morning, so your vitamin C antioxidant. The things that I wouldn't normally say to splurge on are your cleanser, your moisturiser, and even your SPF. I think you can get those all really on a budget.
Yeah, I completely agree. And I think that all of these at-home devices, like the at-home microneedling, at-home laser devices, at-home LED devices, they're really expensive. And it's not just the expense of them that I have a disagreement with. It's the fact that that money could be better placed by in-office dermatology procedures. So like the intense pulse light that Ellie talked about, or some of the other energy-based devices where you can see a meaningful shift or change in the skin. If you've got brown marks that have appeared on the skin, yes, you can keep them away with your vitamin C, your retinoid at nighttime, and your SPF. You can keep them away, but to actually get them away so that they are gone, most people will need to have a laser treatment to get rid of them. If you've got visible veins, you will need a laser treatment to get rid of that. And then, yes, you can do the other stuff to keep it away, but you need to be able to get rid of it first. And you're much better to spend your money on that in-office procedure with a reliable person, please, rather than thinking that putting one of these masks on your face every day for 40... I mean, who has that time?
I know. How long are you meant to keep those LED masks on?
Various amounts of time.
Yeah.
Too long.
I wish I had that time.
Yeah.
I might just say it works really well so I can have an excuse to just put on, I'm just working, busy, working on my skin health for the podcast.
Even the pressure of it being against your skin, surely that must disturb your microbiome.
And also, you look slightly ridiculous.
No, you look really ridiculous.
I think we need to also talk about some of the treatments that people have to improve their overall look. So treatments like botox, often women will engage in around their sort of 30s, 40s onwards. And you've given a very excellent talk on the multiple medical uses of Botox for men and women.
Oh, I just love that talk. I really do. I don't often get a chance to write a talk that I just think, oh, this is amazing. I love botulinum toxin, Botox. I just think it is one of these magic molecules that we have to play with now. I mean, the uses that we can have for this are pretty phenomenal. You know, it's one of the most toxic chemicals on our entire planet, but yet we inject it into us and it can serve us really well. So the talk that I gave was at the British Association of Dermatologists, and it looks at all of the reasons that why we might use Botox in dermatology. So I use botulinum toxin for conditions like rosacea, and this is really helpful for premenopausal women, because flushing and flaring of the skin is a real symptom of this perimenopausal time. And that tends to happen because you have almost like a quick drop in the estrogen, and then it is this reaction that happens within the body. So you get these flushes and flares, and people describe them as hot flushes. But they can be really, really debilitating. You can often get them associated with sweating as well. And it happens at nighttime. Well, it can happen day and night, but when it happens at nighttime, it wakens people from their sleep. So one of the things I'll do with Botox injections is inject tiny volumes over the face and neck, not enough to cause really much of a change in how somebody might move their face is the way we normally think about using Botox. But it works by its interaction, not just via the nerves that we know, but it actually works on the other cells as well, we're increasingly understanding. And it means that you get this reduction in the flushes and flares that come. And it also allows people to get a better night's sleep because they're not wakening up as a consequence of this. It also makes people have a better quality of life because they're not feeling hot and bothered and embarrassed. And so we can use Botox then for these flushes and flares so that will then, improve the quality of life for women who really do struggle with this sometimes. A lot of women have trouble with hair thinning around this time as well. I mean, hair thinning can often start postpartum, so after a woman's had a baby, and can sometimes never recover. It can also happen because of nutritional changes, but then it is also an issue with hormonal changes, and about half of women in this time have issues with hair. What kind of things do you think about that and talk about?
Yeah, so when I see a woman that's got thinning hair, I normally think about their nutrition profile. So quite often women having periods can be iron deficient if they've got conditions like fibroids. And so what we want to aim for when we look at the normal range for a mineral like zinc, for example, we want women to be sort of in the middle of that range. And something like ferritin, so our iron stores, we want them to be in the middle of that range, so over 70. Because the range actually starts from 23 or something. So you could have like a ferritin result of 30 and think, well, I'm in the normal range, all good. But actually, it indicates that your iron stores are low, even if your body's compensating for it. So your iron level might be within the normal range. So first thing is to address any nutritional deficiencies, because that can be done relatively easily, including vitamin D as well. And then I ask a full history in terms of their menstrual health and what changes they've noticed with their hair. There are some inflammatory conditions that sort of completely separate that anyone can get at any age.
So I'll actually jump in there because a lot of what I'll see is related to the actual just the face. So skin cancers, lumps and bumps, skin treatments, but just for the face. There is a condition that happens quite a lot around this time. It's different to just the hair thinning, and you get a scarring loss of the hair along the front of the scalp. And I suppose one of the things to look out for that, around where you've got the hair follicle itself, you see this red little circle.
Yeah.
And it almost makes tiny little bumps. And so if you notice that your hairline is starting to go back, often it can happen, a good centimetre off it can go back without
you
people
notice
realising.
Like a band of this sort of scarred, thinning skin, like atrophic skin.
So that's a scarring alopecia, which is a bit different, isn't it?
To the sort of female pattern hair loss that we also see increasingly so. I use products, or I recommend products like REGAINE. I normally say or minoxidil. I normally say to buy the 5% foam that's marketed for men, but for women to use that. It's off license to use the 5% version, but I do recommend it. And then there are tablets that we can give to improve how sensitive their hair follicles are to circulating male hormone. So when we think about the shift between estrogen and progesterone declining and our male circulating hormones, our androgens, staying at the same level. So you've got that sort of unopposed male circulating hormones that can affect the hair follicles, cause it to shrink and cause more hairs to go into the shedding phase. And so we want to try and preserve that as best we can. So we can use treatments like spironolactone that we've talked about in another episode. That's a drug used for high blood pressure, but we use it to reduce how sensitive hair follicles are to those circulating male hormones.
So I think that if you are noticing something like changes within the hair, it is actually pretty normal to start notice a thinning of the hair. But even though it's pretty normal, there are treatments that can be put in place to slow it down and address that. But if somebody had this scarring alopecia that occurs around the very front of the hairline, that's something that you do need to act on pretty quickly to try and dampen it down, because it is a scarring alopecia.
And it's a progressive condition. Mm-hmm. So yeah, for sure. And the treatments are different. Mm-hmm. So often the things that are marketed for hair growth won't help this condition. Yeah. The first line treatment is an anti-malarial tablet called hydroxychloroquine.
Okay, I think that we've probably, even though we didn't need convincing ourselves, we both know that menopause is not a skin type.
So to wrap up, menopause is one day, 12 months after your last menstrual period. But in the pre-menopause and perimenopause, there are a number of changes that happen to our skin, usually as a result of fluctuating hormones. And we can address those in different ways. And the advice that we give is very nuanced and specific to the person. And the best way to understand how your skin is behaving and your skin type is to go onto clearer.skin and to have a bespoke formulation made up for your specific skincare concerns.
And thinking about how to protect the collagen that we do have is using things like our SPF and understanding that the skin will change. And actually for some people, the perimenopausal time actually brings a welcome relief and their skin is better than it's ever been before. So it isn't something to be frightened or worried or scared about, and nor ever used as a marketing term. Everybody hopefully will continue to spread the message that menopause is not a skin type. So thanks to Ellie for joining me today.
Oh, thanks as always for having me.
And thank you, my lovely listener, for joining us. And it doesn't just stop there, because we're going to do another episode that's related to postmenopausal skin. So after that single day in a woman's life, and all the tips and tricks to keep your skin healthy for the rest of your life. If you've had as much fun as we've had at the After Hours Skin Clinic, you've probably already subscribed. But if you haven't, please join us. It means you won't miss another episode, and it helps us reach other people. Thanks for joining me, and see you next time at the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.